Hi, my name's Mona. I'm going to assess the heart of my patient Bart. So let's get started. First, as always, we want to start with inspection. So normally it would be best to have with the shirt off, but my patient's kind of shy, so for the purpose of this video, we're going to pretend like his shirt's not there. So to first inspect, I would want to look at his neck, and I would have him turn up and away. I do not see any pulsating there. A light pulsating would not be a bad thing. I do not see any veins protruding. I don't see any turbulent blood flow. If I saw big, huge bulging veins or pulsing veins, I might be concerned about congestive heart failure or maybe some blockage going on. So I don't see anything there. So then I'm going to inspect his chest. And with his shirt off, I would look at his heartbeat here. I could just barely see a little bit of heartbeat earlier. So I know that he is not bulging out there with a heartbeat, so there's not any excessive force to his heart. And then I would inspect for like vessels and veins, that kind of thing. He did not have any bulging, obvious vessel growth out there that I would be concerned about. So with the heart, there's not a lot else to inspect. Of course, I would check for leg distension and that kind of stuff, but just focusing on the heart here. Next, I would palpate, and I would kind of go toward that apex area again. I do not feel a huge force of blood flow there at the apex, which is a good thing. I feel just a very light heartbeat there. So that's kind of it for inspection and palpation. I would also palpate the pulses. I would go to the jugular area and all down the body, but that was not part of this. But with the lungs or the heart, it would be very important to check all the pulses of the body, down the legs and the arm and the feet. So then we're going to move on to percussion. Percussion with the heart, it is possible to percuss the heart and to check the size of the heart, but that is not very accurate. So at this point, I would just check x-ray to see the size of the heart. But if I was going to percuss, I would start out here at the axillary and move in. And whenever I move from a dole to the dole sound, the dole sound would mean that that's where the heart is, because it would be a solid sound. So that would be a dole sound. And then I could determine the size of the heart from that. But again, a chest x-ray is much more accurate. So then we would move on to auscultation, which is actually the best way to, probably the most defining way of checking the heart. So I would just start with the aortic and then the pulmonic, and then I would listen to the tricuspid, or the Erb's point, and then the tricuspid, and then the mitral valve. The aortic is the second intercostal space on the right, and the strongest heartbeat that you hear there is your S2. And you also hear the S2 over here, over your pulmonic. The Erb's point is right in the center, so you will hear the S2 and the S1 about equal. Then when you get to your tricuspid, which is the fourth intercostal space, just right or left of the median, that would be, you would hear the S1 much better there, and you would hear the S1 much better over here in the fifth intercostal space, mid-clavicular, and that is the apex of your heart. So I'm going to listen now, and I'm going to listen for the S1 and the S2. I expect to hear both of those. I do not expect to hear any extra heartbeats. I do not expect to hear S3, S4. I don't expect heart murmurs or any other gallops or clicks or anything like that, but let's see what we find. You can just breathe normally. very strong heartbeat, but it's not very protruding or anything like that. Another thing with palpation that I did not do that I could do, okay, that's good. So that's it for the heart. Thank you.